In that case, we use um, in that case we use the physiologic dose. The dog usually improves pretty well. Um, so that was the so in the typical atypical Addison, you only find the gastrointestinal signs, and in the normal typical Addison, I guess they don't call it typical Addison, it's called Addison. You will find the blood, the sodium and potassium ratio uh, lower than normal. So I forgot to say that. Anything that's lower than 28 is suspicious, but Addison is usually 21 to 17 because you could get a lower than normal sodium potassium ratio with kidney disease, but they just scratched that. That's probably for practical life, for practical experience. In the test, they're not going to give you an abnormal sodium potassium ratio and tell, well, is that due to kidney disease or Addison? They're not going to do that. But what you're looking for in Addison is usually going to be 21 to 17. So let's go back to Addison. Well, the dog presents sick. You run lab work, sick and pale. You look here, it's pale. When the animal is pale, there are two possibilities that he's pale. Reasons, common reason. One, he doesn't have enough red blood cells, so he's anemic. The other one is, well, yes, he does have enough red blood cells, but he has hypotension. He doesn't have enough blood pressure to get these red blood cells up to the periphery, up to the gum for you to see it. So then it becomes pale. So one of two things. Either he's anemic or bleeding, which is going to be anemic and hypotensive, or hypertensive. Okay? So you get an animal. The animal is like lethargic and it's pale. Again, in an ideal world, lots of veterinary clinics do not have the capacity to measure blood pressure. That is okay. Try to get it in there. Try to get a Doppler. Learn how to use it. If you can't, that's fine. Lots of us don't have it. I got it probably 5 years ago, which I've been in practice for 10 years. So for 10 years, I was working without it, and I didn't even know how to use it because it takes like some learning. So you need to have the device to be able to learn it. But anyway, so your presenter was this dog, and he's pale. That should prompt you to measure the blood pressure, and then he's hypertensive. So what do? You run chemistry. You're going to find a sodium and potassium ratio that's abnormal. You're going to find low sodium and elevated potassium. And then how do you treat him? Well, you give him fluids, sodium chloride, because you don't want to give lactated ringer, because lactated ringer has some potassium, and you don't want to give him some potassium, and also you need the sodium. So there's a higher sodium content in the 0.9% NaCl. And then you will need to give him some steroids, because he's got a lack of steroids. So what kind of steroids do you give? Well, you would give dexamethasone sodium phosphate, DexSP. Why not give the other one, the regular dexamethasone? Because if you give the regular dexamethasone, that's going to affect your measurement of cortisol if you want to do that later. But if you give the DexSP, that does not interfere with measuring the cortisol levels. Okay, so that's about the Addison. And again, the hormones that affect the urine production, that's where we got to with Addison, is the aldosterone, And then there's another hormone that affects that. We said that that's the AC, the ADH, antidiuretic hormone. Well, where is the antidiuretic hormone secreted? The antidiuretic hormone is secreted by the pituitary gland under the effect of the hypothalamus. So the hypothalamus will feel two things. One, so the hypothalamus is the part in the brain. It has all these centers. It has a satiety center. So when you feel full, that's your hypothalamus. And when you don't feel full, you want to eat again, that's the hypothalamus. So the hypothalamus will feel things in the blood. It will feel the glucose in the blood. That's what causes us to feel full. It will feel the hypoglycemia. That's what causes us to feel that we want to eat. And it will also feel the sodium concentration. So if we have high sodium concentration in the blood, then the hypothalamus will will stimulate the pituitary gland to secrete less antidiuretic hormone. And if we have low sodium, then the hypothalamus will stimulate the pituitary gland to secrete more antidiuretic hormone, because we have low sodium and we want to hold I'm sorry, if we have high sodium concentration, so the hypothalamus will feel the increased sodium levels and will stimulate the pituitary gland to secrete the antidiuretic hormone, which will go to the collecting tubules and cause the kidney to absorb more water to dilute that concentrated sodium. Another thing is the hypothalamus will respond to stretch receptors, and these stretch or pressure receptors are found in two places: the aortic arc and the carotid sinus. So if we have these baroreceptors, they call them, they respond to pressure. And if we find that we have low pressure, then that means that we have hypovolemia. Then the hypothalamus will also tell the pituitary gland to secrete the antidiuretic hormone. Antidiuretic hormone will go to the collecting tubules and cause the kidney to absorb more water to increase the volume, so we get more pressure to correct the low pressure that the baroreceptors are feeling in the aortic arch and the carotid sinus. So now, what else causes PUPD? Well, another thing that causes PUPD is pyometra. And how does it cause that? Well, pyometra is an infection of the uterus. So let's talk not a lot, let's talk a little bit about pyometra. Pyometra is typically, what the book says, is going to be a middle-aged dog. Of course, it's an intact female. So, by the way, when you read in the NAVLE, if they tell you that it's an intact female, it's very likely to be pyometra, okay? I mean, because everything else is spayed. So, an intact female, it's middle-aged, between 3 and 5 years of age, and the typical time when we notice pyometra is going to be at least a month after heat. If the dog has been out of heat for like a week, are not likely to find pyometra. Because pyometra in the dogs, like in any other animal, in order for us to have this uterus be calm and not contracting, trying to empty stuff out, that's how you build an infection in the uterus. Yeah, I'm sorry if I didn't mention that. So pyometra is when the uterus becomes like a big abscess, becomes full of pus. Okay, so in order for us to not have this contraction of the myometrium to get the uterine content out, we need to have a corpus luteum. If the dog has just been out of heat and doesn't really have a corpus luteum, it hasn't had the corpus luteum for that long. So even if a pyometra is developing, you're not going to really have a full-fledged pyometra until it's been like a month after the heat cycle. Okay? So there are two types of pyometra. One is with open cervix, and if the cervix is open, you're going to see the pus coming out of the dog's vagina, and you're gonna the dog is gonna be less sick. Okay? But if the cervix is closed, then you don't see the pus out, but the dog is gonna be more sick. So how does pyometra cause polyuria? How does it cause the animal to urinate a lot and consequently drink a lot? Well, the most common type of bacteria to be causing pyometra is E. coli. And E. coli has an enterotoxin, they call it. It's a part of the cell wall of the bacteria. When the bacteria dies, and the bacteria in the pus is dying because the neutrophils are eating the bacteria and liquefying it, then you end up with dead bacteria. When the dead bacteria dies, it releases this part of its wall that has a molecular resemblance to the antidiuretic hormone. So it will go to the kidneys and it will block the antidiuretic hormone. It basically acts like spironolactone, like the potassium-sparing diuretic. It has molecular resemblance to the antidiuretic hormone, but it's not antidiuretic hormone. So it's going to attach to the receptor and block the access of the antidiuretic hormone to the receptor. And once we block the antidiuretic hormone, then we'll have diuresis. We'll have the kidney not absorbing the water of the filtrate, and we're going to have more urine. So that's how it works. So how do we treat pyometra? Well, you treat pyometra by spaying the dog. Okay. Let me recap a little bit. So a typical presentation of pyometra is that this dog has been drinking a lot, urinating a lot, feels sick, not eating, vomiting. Then you run the lab work, you find out that the dog usually has an inflammatory leukogram. The one that sometimes they don't, but the one that you're going to get in the Navli is going to have an inflammatory leukogram. They cannot be that mean. Okay. So, you find an inflammatory leukogram. You also find that the dog is azoothymic. What the word azoothymic means, it has elevated kidney values, elevated BUN and creatinine, specifically BUN. So, what do we need to do? Well, we probably need to place an IV catheter in the dog, run fluids, try to get the azotemia down, and give antibiotics, just in case the dog is septicemic. Septicemic means that there's live bacteria circulating in the blood. So you do that, and then you take the dog to surgery. You need to remove the uterus because that's what's causing the enterotoxemia. That's what's causing the toxemia or might be causing the septicemia. They need to take that out. Well, what if he wants to keep the uterus? Well, have him go to a theriogenologist. The theriogenologist is like an animal gynecologist. It's really ill-advised to try to keep the uterus, because if you try to keep the uterus and you've got a closed cervix, you can end up with a ruptured uterus as the uterus tries to contract once you rupture the corpus luteum, because you might not have an open cervix. So that's really ill-advised. If she's got pyometra, then I just spay the dog. That's the recommended treatment. So what else can cause PUPD? Well, Cushing's disease. So Cushing's disease is where the animal will have too much cortisol. And too much cortisol just interferes with the binding of the antidiuretic hormone to its receptors. So that's how it causes the polyuria, polydipsia. So how do we know what's the presentation of the Cushing's? Usually these are small fluffy dogs like the Maltese, Poodle, the Yorkies, Pomeranians, and they have a very characteristic pattern. So if I get to it and I edit this video and have a presentation going with it, maybe, who knows? If I do that, then I will include a picture of the dog. Also, if I don't, just Google Cushing's disease Pomeranian, and you're gonna go to Google Images, or without going to the images, Google will bring you some images of that. Very characteristic. Now, that's an important thing to note as well. So, Cushing's disease will cause the animal to have hair loss, alopecia. So, what makes me think that this alopecia is not allergy, which is the most common reason for anything skin in dogs. So the most common reason for anything skin in dogs or cats is allergies, skin allergies, atopy we call it. The environmental allergy followed by like skin, flea allergic dermatitis, and then there is also food allergy, which is a very uncommon disease, even though every client walking through the door thinks that their dog has food allergies. So the main thing that makes me think that this alopecia or hair loss is hormonal or caused by an endocrine disease versus allergy is because, one, it's non-itchy. Allergy is itchy. They itch. If they're not itching, it's not allergy. Okay? That's one thing. Other thing is, it's symmetrical. So you can draw a line in the animal, and you'll find the hair on that side equal to that side. The hair loss is like the mirror image. Another thing is, it's a normal looking skin. It looks just like skin that's lost the hair. It doesn't look like anything. There's no inflammation, there's no redness, there are no skin lesions. Yeah. That's what makes us think of a hormonal hair loss. And then the hormonal hair loss or hormonal alopecia is mainly Cushing. Another one that causes that is hypothyroidism. So, while we're talking about Cushing's, we're gonna talk about, well, there's Cushing's disease in horses as well. Okay, so Cushing's disease in horses is called PPID, pituitary pars intermediate part dysfunction. So PPID. Well, the reason I'm mentioning that is because it's very easy to remember. In dogs, it affects the hair cycle. The hair is shed, but there is no other hair growing. It affects the hair cycle. It affects the hair cycle in horses as well. So the horses don't really shed. Okay? So you find the horses with weird growing hair, called heritism, lots of hair, and that's the PPID. Now in horses, we're not really having a problem with the adrenal gland. We're having a problem of dopamine. So dopamine in horses will suppress the production of ACTH, the adrenocorticotrophic hormone. Okay? So because there's lack of suppression, that's why it flares up. So we give them a dopamine agonist called pergolide, and there we go. The treatment of PPID, which is the Cushing's disease in horses, is pergolide. What's causing it is lack of dopamine, and the main sign is the hair. It's a pretty common disease and it goes by tens. So horses that are 20 years or older have like 20% of these horses have PPID. And if you have horses that are over 30 years of age, you can have up to 30% of them having that. The abnormal hair distribution is one of the things that you notice. The other thing is abnormal sweating. And then the other thing is fat deposition, and that's you see like a big belly to the horse. So let's get back to the dog. So the dog has Cushing's disease, got PUPD, drinks a lot, urinates a lot, and has this characteristic hair loss pattern. Now, another thing to note, and again, I'm sorry I jumped from one disease to another, but that's how I remember them, by contrasting and comparing them. There's something called alopecia X. So alopecia X is a dog that's a Pomeranian usually. So Pomeranians get Cushing's disease a lot. So that's the Pomeranian, okay? So it doesn't have Cushing's disease, but it has a hair loss pattern that looks like Cushing's. Why do we think that this dog does not have Cushing's? Because it's usually a young dog. So Cushing's disease, it's an older dog, like 10 years or so. But you got a dog that's like a year and a half old, intact male dog, and it's having hair loss that's really similar to Cushing. That's alopecia X. So how do you treat it? You neuter the dog. The dog is usually intact. And it's similar to male baldness pattern in humans. It's the male hormones affecting the hair follicles and causing them to undergo atrophy. Well, you neuter the dog, sometimes you get the hair back. Most of the time, my experience, sometimes you don't. So that's what alopecia X is. Alopecia X is a hair loss pattern in Pomeranians usually that looks like Cushing, but it's not Cushing, and that's a young dog. Cushing is an older dog. Now, another thing that's really important to talk about with Cushing's disease is Cushing's disease will cause muscle mass loss. It causes fat deposition. The dog's got the big belly, just like the horse, and it causes muscle mass loss. Why? Well, because cortisol, that's really important to remember, really important, is an anti-insulin hormone. Okay? So what does anti-insulin hormone? It wants to raise the blood sugar. Insulin brings the blood sugar down. The anti-insulin hormone wants to bring it up. Another anti-insulin hormone is the thyroid. Okay? Which reminds me, one of the subtle things that you might find in Addison's disease, that might be beyond the realm of the Navli, but one of the things that you find in the Addison's disease, which reminds me that this likely is going to be Addison's disease, is you find hypoglycemia, or you find the blood sugar really on the lower end of normal, around like 70s, 80s kind of thing. Yeah, that makes me think that that's probably Addison. Why? Because cortisol is an anti-insulin hormone. It raises the blood sugar up. So if I have low sugar, that probably is because of a misbalance between the insulin, which is the insulin hormone brings the sugar down, and there is not another hormone that will raise the blood sugar up, which is the cortisol. That's the main one in the dog. There's also the thyroid in the dog, but usually I don't have a problem with thyroid. In the cats, you have hyperthyroidism, and that can cause elevation of the sugar as well. So back to the muscle mass loss. Why do we have the muscle mass loss? Because in an attempt to raise the blood sugar, cortisol enhances gluconeogenesis. Gluconeogenesis means that we take the protein, convert it into sugar to raise the sugar. And, well, when the animals, once he's done with the food, then it turns on the muscle, and that's causes muscle mass loss. So, another thing that we see in Cushing's disease is you see recurrent infections, especially in the kidneys. They scan his kidneys and you can find like pyelonephritis sometimes. You find lots of UTIs, urinary tract infection. Well, why do you find urinary tract infection? One, because cortisol is an immunosuppressant hormone. That's why stress will suppress your immunity and causes you to get diseases. But the other thing is the concentration of the urine prevents the growth of bacteria. So it's like when we salt food or when we have high sugary food, concentrated environments prevent the growth of bacteria, and that's what urine usually is. But if I dilute the urine, then the urine is not concentrated enough to inhibit the growth of bacteria, and we'll have bacteria. So you got Cushing's, you got urinary tract infections. So, well, how do we diagnose Cushing's disease? Well, you can use radiology, you can use ultrasound, you can use a board-certified radiologist to look at their adrenal. I mean, happily, after like years of practicing, I was able to finally diagnose my first Cushing's disease by ultrasound. I think that the right adrenal gland is the second hardest organ to picture with ultrasound after the pancreas. So, I mean, I don't want to be talking about lots of other stuff, so we'll just leave it at that. But with practice, you can probably get it. The left adrenal is way easier to get. So when we're using the ultrasound, because the next part is an Navli question. Well, if you're having a pituitary dependent Cushing's disease or pituitary dependent hypoadrenal corticism. That means that the problem is not in the adrenal glands. The problem is that we've got lots of ACTH being secreted. So in that case, you find both adrenal glands big. But if you have an adrenal tumor, you'll find one gland was the adrenal tumor, and you'll find the other gland small because the too much cortisol is being secreted goes to the pituitary gland and causes it to secrete lower than normal ACTH, which does not stimulate the other gland to grow, but the one that has the tumor doesn't care if there's stimulation or not, it just grows because it's a tumor. So these are the two types. There is pituitary dependent hypoadrenal corticism, and then the other type is the adrenal tumor, and you can diagnose that with ultrasound. On the one, you're going to find both adrenal glands big, but on the other type, so that's pituitary dependent, where there's too much ACTH and both glands will grow, become bigger. And the other type where you have an adrenal tumor, you're just going to find one gland was an adrenal tumor, and the other gland is going to be smaller than normal. So that, I mean, can confirm the diagnosis of Cushing's disease. The other test that they like is called low-dose dexamethasone suppression test. So it's a suppression test. I'm testing if I can suppress these glands or not. A diseased gland will not suppress. So I give normal animals, I give him an external source of cortisol, and that will suppress the gland. The gland will stop secreting cortisol because I've already given it from an outside source. But an animal that's got Cushing's disease, that's got an abnormally active gland, because its gland is so active, it's not going to care that I gave an outside source, and continue to secrete the same amount of cortisol, and I'm not going to get suppression. So you give 0.01 milligram per kilogram of dexamethasone, and you measure the cortisol right before you gave it, and 4 hours after, and 8 hours after. The most important one is the one that's 8 hours after. At 8 hours, if it's suppressed, it is consistent with, it's not consistent with Cushing, and if it's not suppressed, then it is consistent with Cushing. By comparing the 4 and the 8, you can find out or also get an impression of whether that's pituitary dependent or that is an adrenal tumor. I honestly don't remember what the difference is, but by comparing the 4 and the 8, you would. So that's the one. You treat it with a medication called Vetoril, and monitoring the treatment is usually done by ACTH stimulation test. So if we want to diagnose Addison, we diagnose Addison with ACTH stimulation test. We do not diagnose Cushing with ACTH stimulation test, but we monitor the treatment with ACTH stimulation test. Now again, recently there was an article, I think it was like 3 or 4 years ago, they're using the pre-pill cortisol level for monitoring of treatment. So the pill is given twice a day, and we give it just before just before we give the second pill, we draw a sample, send it to the lab, and based on that cortisol level, the pre-pill cortisol, we determine if we're going to increase, decrease, or maintain the same dose. So what else? One of the other important signs of Cushing's is polyphagia. The animal eats a lot. So going on with PUPD, polyuria, polydipsia. What else causes polyuria, polydipsia? Well, kidney disease. So chronic kidney disease is going to cause something that's called hypothenuria, meaning that it's going to cause the concentration of the urine to be less than 1.030 and less than 1.035 for cats, less than 1.030 for dogs, but it is going to be higher than 1.008. 1.008 less is called hypothenuria. That means that there's a hormonal effect that's causing the kidney to throw water into the urine. So it's not that the kidney is not able to absorb enough water, which would be kidney dysfunction, chronic kidney disease. No, it is that the kidney is throwing more water into the urine. So if you get 1.008 or less, you're kind of ruled out chronic kidney disease. Okay. So chronic kidney disease is, again, simply it's a failure of the kidney to respond to the antidiuretic hormone. So a failing kidney would not be able to respond. The kidney will kidney has other functions that also happen when we have chronic kidney disease. One of them is going to be anemia. Other one is going to be hypertension, and the other one is going to be hypercalcemia or hyperparathyroidism, secondary hyperparathyroidism. So let me explain that. There's something called the juxtaglomerular cells in the kidneys. In these juxtaglomerular cells, so the glomerulus is this thing that's by the Bowman's capsule. Okay? That's the sieve. That's the capillary network. So